Hello and welcome to another episode offered to you by the Synapse e-learning series. Today we're going to be speaking about how to deal with major incidents, and with us today we have Dr. Michael Spiteri, a consultant in emergency medicine at Mater Dei Hospital. Welcome, Doctor, and thank you for accepting our invitation.
Hello.
We're going to speak about mass incidents. What do you understand when we say a major incident which involves mass casualties?
Well, in essence, any mass casualty incident is an incident where the number of casualties and the requirements to deal with that incident are actually outweigh the number of the available resources present at that point in time. So it's not really a question of numbers, but it might be just 2-3 casualties, depending on what your resources are at that point in time.
And in Malta, are we immune to such incidents?
No, definitely not. We've had experience with mass casualty incidents. Luckily, over the past decades, these have decreased in number. But certainly, even judging from the experience of other countries, we are certainly not immune from having any other mass casualty incident. Again, one major factor that is important in our particular circumstances is that we are a very, very small country with very limited resources. Therefore, any even minor incident on international terms might easily outweigh our resources.
And in fact, that's what my next question is going to lead to. On national level, how do you think, how well are we to deal with such incidents? How well equipped?
Well, like any other question in medicine, the answer is it depends. So, after calculations that we have done, any incident which results in more than 6 priority 1 casualties or more than 6 seriously injured casualties might result in a major incident. That is not something that we dreamt overnight. It is based on mathematical calculations and mathematical projections of our capacities. Therefore, yes, the possibility is there. We as a country have a degree of basic preparedness. But there is a lot of work that still needs to be done in order for our country to be better prepared to deal with any eventualities.
And in fact, what are the fundamental principles to make us as a country more prepared to address these eventualities?
Yes, over the past years, we have embarked on projects to increase our level of preparedness. So, in essence, what is being done is there is an ongoing investment in a number of pillars, I would say. First is this sort of preparedness is called the 4S approach. So initially you start training your staff. So you have people who are more trained in dealing with major emergencies. For example, over the past few months, I would say now, we've had major incident preparedness included in the curriculum for specialists in emergency medicine. So it's now compulsory for all emergency physicians to be trained in how to deal with a major incident. We are also investing in stuff with that is equipment that we need to augment our capacity as a hospital, as a country, as a nation to deal with such incidents. Structurally, we also have ongoing programs to increase our capacity to have more space to deal with such incidents, and also systems. So we are all the time renewing our major incident protocols, at health level, at national level, so that they reflect the requirements of the day and the most recent advances in the field.
And can you divulge some scenarios which you're preparing for here on national level?
Well, it is very difficult because the past isn't a guarantee for the future, and we have seen many scenarios where things turned out in a way that the world didn't even think that could possibly happen. We've had incidents where fiction was probably more realistic than the truth. So definitely there are many challenges that our nation can face, both internal and external. However, the types of emergencies don't really change the way how we prepare for them. Therefore, we're more speaking of numbers rather than actual scenarios per se.
And earlier on, you've mentioned that in comparison with other countries, luckily, we do not have such major incidents. But then again, even minor incidents may have a big impact on us.
Yes.
What have you learned from that which has happened in other countries, maybe neighboring countries, in addressing incidents which may happen here?
Sure. Well, we have seen countries bigger than us who were faced with very serious incidents, and even given all the resources, they were unable, or initially at least unable, to mount a satisfactory response to cope with their demands. It doesn't mean that they weren't adequately prepared. It just means that major incidents can take everybody by surprise, and it's difficult even for the most prepared to deal with these incidents. Otherwise, by their very nature, there wouldn't be major incidents. Other countries, big countries, have reviewed their systems, and following several incidents, especially the most recently, sort of in our recent past, around the 9/11 and the 7/7, many systems have changed. Mostly these include staff training. We need a larger pool of staff who are trained, have basic levels of training in major incident preparedness, but now we have to start focusing into having smaller teams of highly specialized people ready to deal with possible incidents. Not just from a medical point of view, not just from a treatment point of view, because really and truly the day-to-day treatment will not change in case of a major incident, but more in the logistical handling of a response. And that is what changes during a major incident. So, for example, UK has invested in HAR teams, in National Ambulance Resilience Units, which are small units composed of very few members of staff, but who are extremely specialized in dealing and in commanding and controlling an incident.
Imagine I'm a medical professional who's keen on learning more about how to tackle major incidents. It's a research field, a field which I intend to specialize in. What resources are available to me in the future to better my knowledge of the subject?
Good. So, major incident medicine is probably unique because it is spread across many specialties. It can be approached through emergency medicine, through family medicine, through anesthesia, through surgery, even going out as far as public health. So it's such a big area that input from different specialties is always welcome. My advice would be for people to opt for their primary specialty, for example, emergency medicine, and then eventually sub-specializing into major incident medicine. There are many courses out there spanning across different levels, from diplomas, certificates, diplomas, masters, and even PhDs. The bigger the pool of these people, the safer and the more comprehensive our response would be.
Thank you, Doctor, for your time and patience. We hope that this episode has helped you learn more about the subject of major incidents and how we deal with them. This concludes another episode of the Synapse e-learning series. Thank you for following us.